This manuscript describes our experience in a physician health center, which is kind of a unique clinical service provided here at the Mayo Clinic, open to physicians who are in practice anywhere in the country. And typically people are referred to the program because they're having some concern about their ability to practice because of their own health condition. I'm Dr. Melanie Swift, Associate Professor of Medicine at the Mayo Clinic, and I'm here to discuss with you our forthcoming article called Outcomes from a Physician Health Center. This will be appearing in the January 2024 issue of Mayo Clinic Proceedings. We also see physicians who just are seeking confidential and efficient evaluation for complex health conditions that are not impacting their practice. We looked back over 6 years of our experience in this program and did an evaluation in a very rigorous way to determine what those outcomes were and whether there were determinants we could describe that predicted whether physicians who were having a problem with a health condition were able to continue practice, needed restrictions, or were unable to practice, and what were those factors that were correlated to those different outcomes. We evaluated over 150 physicians who have been seen in this program, and they came from 34 different states and 34 different specialties. So it was a wide variety of people. And the demographics were pretty typical for this group of people with an median age of 56. And about 3/4 of them were male, which is fairly typical for this age group of physicians in the US. What we found is that about 60% of them were having some sort of concern about their ability to practice safely because of their own health condition. And when that was the presenting complaint, the most common type of condition was a neurologic condition. And this could have been a cognitive concern, or it could have been a movement disorder concern. The second most common was a psychiatric issue. And this was really exclusive of substance abuse. The program is not designed as a substance abuse evaluation and treatment program per se. For those minority of physicians who were not having any occupational concern, over half of them had multiple medical problems. When we looked at the occupational outcomes for physicians who were struggling with a health condition, we found that actually very little correlated with our recommendations for their continued practice. The two things that did correlate with a recommendation to restrict their practice were the presence of a neurologic condition that was usually cognitive in nature, or a psychiatric condition. There was a really important difference, though, in the physicians who required restrictions for those two conditions. For people with neurologic conditions with cognitive impairment, they most likely were recommended to discontinue practice altogether or had a permanent restriction with perhaps some intensive monitoring. However, physicians with psychiatric illness really were able to return to practice with only temporary restrictions. And this typically correlated with recovery from a hospitalization or stabilizing their condition on a new medication regimen. The goal of the program is to make sure physicians have an accurate, unbiased diagnosis, that they're evaluated in a confidential way, and that every effort is made to make sure they're getting the best possible treatment and can have the best possible function. So it's no surprise that the majority of people who came through our program were able to return to practice without any restriction, or at most a temporary restriction or graduated return to work. We feel that the findings of our program should offer physicians hope. There are not many programs in the country where physicians can go for occupational evaluation for any medical problem, from musculoskeletal to cardiac to psychiatric to neurologic. But in this program, what we found is that most physicians who came, despite their concerns, we were able to find a way for them to maintain a safe practice. And for those who were unable to, we were able to guide them toward that process of disability or retirement. in all, we want to encourage physicians to seek evaluation through formal channels rather than resorting to self-diagnosis or informal curbsides, and to realize that with optimum treatment, most medical conditions are manageable and will allow the physician to continue to practice. For further details, I would like to invite you to read our article, and please reach out to the corresponding author with any questions.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.